First of all, I want to say the thanks to company Jetema for the incredible meeting, the academic meeting. It's very honor for me. I am Dr. Sabuhi Abilov from Azerbaijan. I want to talk about the efficiency of epitic pillars in my own technique, normal knowledge sleep augmentation technique, and explain the perioral region anatomy. The understanding the perioral anatomy is very difficult because when we are consider about the lip augmentation of the patient with age, we have to consider the structured anatomy because the rejuvenation of the perioral region can be very challenging because the many factors that affect the appearance of this area, and such the repeated muscles movement and also the bone resorption and decreasing of the fat, the volume, it is give the influence the form of the lips and also perioral region structure also. The lip inversion with age. This is true, and when we are considering to injecting which kind of the filler to the lip, before we should analyze the patient's age with the structure of and their facial structure, and full lips are property of the youthful healthy appearance. That's why the changing in the lips morphology during the age include the positioning the lip lines and also inversing of the lips inside to the mouth, and that's why when we are analyze the patient, we have to think about the supporting system of the perioral region. And first, our supporting system is a skeletal supporting system, which you can see in the slide. The skeletal supporting system is maxillar bone and mandibular, and also teeth, maxillar and mandibular ligaments, and apertura piriformis. The teeth play a big role on the lip and also perioral region appearance, and that's why firstly we should consider about the teeth and teeth loss of the patients. That's why loss of this bone cause the jaw formation and to shrink and result in the condition called facial collapse. There's a facial collapse when the patients come to us to the lip augmentation and lip volumization. We should explain this to our patients. And also the skeletal resorption. With regard to the aging change, the maxillary skeleton appears to rotate clockwise inferior to the orbit and become retrusive, and as a general pattern, the midface contracts and deteriorates with age. What does this mean? When we are see the skeleton, the apertura piriformis in the next apertura piriformis start to be the wide, and that's why sometimes when we are doing some nasolabial injection, wing fold injections, and also lifting the upper lip, we have to consider this wideness. And also the fossa canina is also going to be the invaginance, and that's why the invagination of this area appears like the lips collapse and ptosis. Resorption below the mental foramen and reduction in the alveolar heads also influence the perioral region appearance also. And our next supporting system of the perioral area is ligaments. And ligaments, as you see in the the slide in the illustration, when our the deep and superficial fat compartments decrease, and also our ligaments also going to ptosis, and that's why we should consider ligamental ptosis and take some preventive procedures for them also. And when we see the parallel mode and also parallel region has not any ligamentous retain ligamentous structures, and all of these ligaments stood at the far from this region, and that's why the ligamental analyzing of the parallel region is also important. And in cadaveric dissections, our fat, the dental occlusion also important, and when we have the first degree or the third degree of intrusion of the this and this is also makes some complication, and we have not used the standard lip augmentation techniques for the patient. Supporting system, the superficial and deep fat compartment is also made a big role of the parallel appearance. The thin, we have the complex system of muscles, thinner lips in the 25 years old. The human lips also changing in adulthood also, and deeper nasolabial folds. It's started to be from the 35 years old, and marionette lines and droopy mouth corners, and this. The classification, it gives to us to think about how we can use all of the techniques to rejuvenate of this region and also rejuvenate this peroral area on the patient. The superficial peroral superficial fat compartments. In this week, Katafana announced new article work with Christopher Surg et al. The labial fat compartments and labial and the parts of the face, and these compartments may role, and the crucial role is in the retroorbicular oris fat pad. With the upper lip and fibrofatty compartment exists deep to the orbicularis oris muscle, which appears to lose turgor with age. And the deep fat of the upper and lower lips, deep to orbicularis oris, may act as supporting foundation. And lateral deep fat may also contribute to lip support, and in the case with the SUF, this fat may contribute to the stigma of facial aging. For example, in the retroorbicularis oris fat pad, when we are injecting to when the lips ptosis with age, and also lips distance between columella and vermellum border is very high, we use this technique to which the offered by Christopher Surg, and this replacement of the fat with dermal HA fillers is very helpful, and to get the good appearance, good reshaping of patients with minimum minimum volume of filler. And also retroorbicularis oris fat pad is parallel, it's crucial, may role crucial role in the parallel rejuvenation, and also the replacement roof is very good option to use minimum dermal filler and getting the good result, especially in the male patients. And superficial deep fat compartment and also superficial and deep fat compartments it consists of superior upper lip compartment, lateral upper lip compartment, and inferior lateral upper lip compartment, and central upper lip compartment. And the complex, the muscles complex of the face of the parallel region, and parallel region consists of the approximately 12 facial big muscles, and that affects the shape and function of the parallel region. Muscle in the parallel region can be classified according to their origin and insertions, as well as by their location with respect to the major structures. In this illustration, you can see how the parallel region consists of with the muscle and orbicularis oris muscle. Orbicularis oris muscle is the complex of the complex with muscles, which the 3D MRI isotopic study in vivo demonstrates that parallel musculature has a unique architecture, which a lot of circular fibers in the lateral extends and elliptical, and deep fibers of the orbicularis oris are a result of interlacing proxinator muscle fibers, whereas the superficial fibers of the orbicularis oris arise from a coalescence with the lip elevators and lip depressors. And there we can see all of the muscles which interact with modulus and insert to the modulus. And there is the ontogenic subunits of the upper and lower lip. Our upper lip in the ontogenic with ontogenic subunits, the two lateral subunits and the medium subunit, which call it the philtrum. And also lower lip constitutes the two lateral subunits. And this is very crucial, very important to when we are deciding to use the dermal filler for augmentation of lip augmentation procedures. Aesthetic subunits and the lower lip, it's a vermilion, is a lip hypoplasia and thin lip, disrupt the facial harmony and can result in the perception of the nasal tip or mandible over projection. And the lip vermilion is a mobile muscular fibrous structure that surrounds the most external part of the mouth. As in its internal limit is the oral fissure and the external limit of the skin to the upper and lower lips. Full lip fullness grading scale. Our patients come to us with with very thin lips and also with full lips. And that's why when we are want to do some lip augmentation and lip volumization technique, I prefer to use my technique, the normal lawless lip augmentation technique, because our aim to use the hyaluronic acid fillers like a replacement of the superficial fat compartment in the between skin and vermilion, and that's why in normal knowledge technique we use quite low amount of the filler to replacement of this superficial fat compartment and giving to the patients quite natural, quite aesthetic appearance. And also the advantage of this normal knowledge lip augmentation technique is the minimum amount of entering points with needle. The injection site, in this illustration, in this slide, you can see which side of the aim to put the injection hyaluronic acid filler. We use especially 30 gauge needle with certain millimeter length, and the main target area is the space between vermilion and also orbicularis oris muscle, and which you can see with arrow like inside injection site. Injection technique is creating maximal space with needle in the subvermilion area and injection HA dermal filler in the created cavity. We will turn up the lip to force creating the space in the subvermilion area. And our main injection point is the apex of Cupidon bows. There in this video illustration, you can see what I want to show. You see the needle is very superficial, yes, and the main target of this technique to entering in between vermilion and orbicularis oris muscle. In this space, we can put our hyaluronic acid filler and little bit turning up the lips to creating the big space, big hole, or big cavity. And then we are putting our dermal filler. And next slide, this is a continue of the technique. We are doing the good message to, you see that how the shape of the lip is changed. It's in the lower lip, it's the same. We are entering the quite superficial. You see, we have used to hold of the upper and lower lip the approximately 0.5 ml of the Epitic S300, and that's why this technique gives to us a big advantage. You can see in the photos how the shape of the lips is changed, and volumization is very good. Patient happy and satisfied, and we have used the 0.5 and 0.6 ml of the filler. And our next patient also here. We're doing good message also. There also, we have used 0.7 ml to 8 ml to reshaping and do some augmentation, lip augmentation. There also we have used a little amount of the dermal filler. There is a 0.5 ml, 0.5 ml. In conclusion, before lip augmentation procedure, we should detailed analyze the patients and dental occlusion, type of lips, and choose appropriate dermal filler. For my practice, and when I giving the seminars and workshop for lip augmentation and perioral rejuvenation, I advise use the Epitic S300. Why? Because the Epitic 300 is more plastic and more convenient dermal filler for lips, and also it gives quite natural shaping and quite natural smoothing to the lips. Because when we use the hardest and when we use the more soft filler, we cannot get the good reshaping and good volumization. And that's why for me, for my students, the ideal dermal filler for the lips, this is Epitic S300. And no more knowledge lip augmentation technique. This is a minimal traumatic and good reshaping and revolumization technique, all types of the lips. Thank you for your attention. Thank you for time.